And he looked at me like, really, this is what you're worrying about now? And he told me that. Like, that's when I realized, like, oh my gosh, that's how, connected you are to her. That, and even in the hospital, so many times where, the doctor doesn't reach on time, or, you want an epidural but takes a while, or anything can, so you still have to always, what do I do in that moment and how do we do it? So
This is the Birth Agni podcast, the fire that brings us alive, that burns myths and opens a channel of authentic natural birth stories. This show debunks the many myths of the medicalized births, showcases the plethora of choices a pregnant couple can make to embark on their empowered birth journey. I'm Divya Kapoor, a certified birth and lactation counselor and an aspiring traditional birth attendant. Let's get the flames blazing high. In the last 5 episodes, we discussed the basis of natural birth, the top 5 ways to approach it. If you haven't yet tuned into it, do listen to the Birth Better series before this. This is Namrita's second birth experience, a home birth with a midwife. Here she takes us at length about the difference in care under a midwife, the similar labor and transition, the story of allowing the vaginal tear to heal on its own. Namrita spoke about her hospital birth experience before this in episode 72. I urge you to listen to that one before to be able to fully comprehend the sequence of events and references. Namrita is a birth and parenting educator, mentor, and coach, founder of The Nesting Heart. Namrita is the mother of 2 beautiful children born 7 years apart in incredibly empowering births. You'll listen to her second birth story, a home birth, here and now. So, the last time we spoke about the transition and the pause before entering the gate of motherhood,
yes.
and you spoke about how different it was than it's narrated
Mm-hmm.
in the world. Uh, and then you went on to for the second birth, you decided to have a home birth. So,
Yeah.
how did that decision come along?
It wasn't anything, I think, that was planned, I guess, as we were preparing for the second baby. A bit of context to that is I got into birth work after my first child. So obviously, I was a bit more familiar and I had all these options. And I grew to be very comfortable with that idea, I think, because of my work much earlier on with the idea of birth being like a family event that, and
Mhm.
another big reason I think for me to at the time to consider a home birth for my daughter to be involved in the process. Now, as someone who is a girl who might one day want to have children, of course, that is a choice. I will be open to that. But I wanted to normalize that for her, just as I did with breastfeeding, just as I did with women's bodies. Like we speak about it a lot, so that one day when you wake up, it's suddenly not like a shock to
Yeah,
the system.
that's so beautiful. Yeah.
Exactly. And because that was how it was for me, right? Like you spend your this childhood in this darkness, right? You have no idea about how anything about making babies, having babies, and then suddenly you're like, oh, that's what it is. And it's very beautiful how children are so accepting of those facts. Like there's no awkwardness, there's no embarrassment, especially if you normalize that, it just kind of flows. So I've spoken to her about birth. She knows the work I do. So she's known that babies come out of vaginas like from the time she was, and again, it's very normal. It's not for her, she just takes it and then goes on with life.
Yeah,
There's no
yeah,
dwelling at that point. And
yeah.
and so I wanted to continue that again with the spirit of this is just normal. It's not, out of the ordinary, it's not this. And I wanted her to witness that. And I really wanted her to be a part of that. Because again, this was a baby that we all really waited for. We all wanted. She wanted a sibling. So a lot of having the sibling was actually motivated by her very ardent desire to have a baby in the house.
Wow.
So it was, and she was very connected with him in the pregnancy. We did a lot of things together. So I think that really was for me the ultimate, like if she were to be able to be there to welcome him, wanting her involved, I think. And in fact, where I was living at that time, it is not a done thing. There isn't a system to support that. As I think, how the stars align, right? My husband had to move countries to change jobs. I contacted someone that I knew as a doula friend, as a therapist, if we were just talking, and then she threw a name out and she said, I know this person. Why don't you just meet her because you're moving? She's in the birth world as well. And that's really how it started, because that person turned out to be a home birth midwife. But the first person I did meet was an OB-GYN, like I said, because I was still
Mm.
like, let's pursue that because that's sort of familiar. It's something that
That
um,
was around COVID, was it, right, Hannah?
it was in the middle of COVID, yes, but it was also
Mm.
the tail end. So things, I mean, at that time
Mm.
we didn't know, obviously, but now when I look back at it, I think there was about 8 months of that craziness left, at least where I was. So we met the OBGYN, and there was also the option of a birth center and all of that. So again, we were just exploring options at that time, and interestingly enough, the midwife had COVID herself, I think, at that time. And so she didn't respond right away. And so I wasn't sure what to think of it. I said, maybe, she's not available or she's on break. I mean,
Right.
things change for people. So we met the doctor because I again heard that he was someone who respected women's wishes. And I went, and it didn't feel 100%, as a lovely person. It wasn't on him.
Well, what happened? Do you have a
Um, that's the thing. I don't think it was something complete. So that's where I think the midwife story came in. So when I met her, I was like, she's who I want to go with.
okay?
I think it was also
Yeah,
that. So it
yeah,
if I guess there wasn't more choices simply because he was known to be someone who was supportive, I would have probably continued with him. Especially because there was also that birth center option, and it was a nice middle ground. Because at that time, again, because of COVID, there were a lot of protocols that I was very concerned about, again, because that was my baby's chance at his birth. That can't be repeated. And if I could protect that, I wanted to be able to do it. So I
yeah,
thought a birth center would be nice in between.
yeah. And do hospitals not allow children in there here in India? Of course not, but there.
No, I don't think so at all. I mean, I've
Mm.
never asked around, but I would assume because I mean, and
Never heard stories.
no, I never
Yeah.
heard stories. I think they come to visit, right? That typical hospital scene we see where there's the baby bundled up and the
Yeah.
older sibling comes in to say hi. But no, I don't think in the birth at all. Unfortunately, no. But again, I also understand it's a system. Like they need to
Mm.
have their
Yeah.
policies for their liability, etc. But no, and at that time again, because it was COVID, I think even with husbands, it was a bit iffy. Like if there could be partners
Yes.
involved, there were no doulas allowed. So there's a lot of that um, being on your own and laboring. I've heard those stories. So again,
Yeah.
it was a crazy time. So everyone was
Definitely.
trying to, I think, just do the
And yeah,
best.
of course, that was a crazy time. And around the world where husbands are, that acceptance is there that husbands should be there. They're a part of labor and birth as much as having the baby. And it's incredible that here, the mothers that I work with, they come back and tell me, oh, husbands are not allowed in the hospital in
Yeah,
the laboring. And it was like, where, like, which century are we in?
yeah.
This just breaks my heart.
Absolutely. I think the saddest thing is a woman laboring alone. I think you just need so much support, and the fact that we don't recognize that. And then, of course, you have nurses, but they're not, their job is not labor support. If they do it, that's great. But their primary thing is charting and making, collecting data and making sure things are going on. And if you add another task to, they're already stretched because there are multiple mothers that they're probably, supporting, and they have to go from in and out, and every mother, I think, deserves one person for her that's there just with the sole purpose of supporting her.
Yeah.
And that's where, husbands can actually be that, because they have that connection, they have that trust. And here, interestingly, I've actually never questioned that, because it is such a part of
Given.
mom. Even I mean, I don't know, obviously, before I gave birth, but since the last it's been 6 7 years I've been teaching. I think they come for classes. It's kind of given that they would attend the birth and labor. Right now, I think now the battle is with like the cesarean birth, so the OT. So not that,
Mm.
still, there's a bit of gatekeeping there where they aren't allowed inside the OT in some places.
Hmm. And how did the care look like with the midwife? Then, you
Uh,
know,
I think in midwifery care, again, that both people feel aligned. They don't,
yeah.
feel sufficiently comfortable to support the couple, and the couple feels the same way. So there was a lot of kind of like history taking, just background, just like, why, again, what you asked me, why do you want a home birth? Like, how's the previous birth? All of that. And yeah, towards the end, she said, I'm okay to take you on, like, have a think about it. This is kind of what it involves. And if you're okay, we can start. And so we went home. I think my husband was pretty much like, if you're okay, like I'm okay. Like I don't have very strong sort of opinions, I think, in that space where I think he would have said, no, you have to go to this. So, and he seemed very comfortable with her. That was a nice thing. And I think what was also reassuring was that she did explain to us, I don't know if it was at the first appointment or later, that she does have a backup. So if there's a
Oh,
transfer needed, she had an OBGYN who was supportive, I mean, who understood her work and was willing to support that. So it
that's
wasn't,
lovely. Yeah.
so there was a system in place, and I think that was very reassuring. Yeah, so we just agreed to go with her, and I think the difference in care was that it felt much more relaxed, and lots more time to explore other things that come up for birth, in addition to oftentimes, for example, in prenatals, you don't really talk much about, you do a scan and you say everything's good, like da da da. It's very, very brief. It was much more relaxed, and there was lot of time given to nutrition. Like, and I know even with nutrition, people do talk and say, eat this, eat that. But she really went into, because I was not eating well at that time, because we had just moved countries, we had stayed in quarantine, so it was lots of outside food, lots of hotel, but I wasn't cooking
Yeah.
because we hadn't had a house. And in general, it was my second birth, so I was also busy with my daughter. So it was, and so she was very, very particular that, she sees my levels and really give nutrition the importance it deserves in that, because I've always believed that, and since then it's just even become stronger, that food can heal. There's a lot of things you can do with eating that
Yes.
then actually, change the course of the birth and the pregnancy and postpartum. So, and a lot of excavating of fears I had. So even if I was in birth work, there were fears. There was, can I do it this
Yeah.
again? Like, am
Yeah,
I?
you're a human at the end of the day. We all carry our own.
So,
Yeah.
so a lot of time was given to that, which I wouldn't have expected, for example, in a hospital setting, because it just isn't the
Model.
structure for that. There is no space for exploring those, right? So,
And then how did it all like kind of begin? So with her, she gave you classes, of course, like um, her kind of care and
right. She did, yeah, she did have classes that she teaches, and she's, that's kind of included in the package when you work with her. So she did say, attend that. And I think it was very good for my husband, because a lot of that stuff, obviously, I forget how many sessions it was. It was like a few weekends that we attended, and, just kind of got an overview of her approach and what she prioritizes, because I think everyone has their own sort of main thing that's important to them. And for my husband, it was a great refresher, because for him, it had been 7 years.
yeah. So about emergencies, were you like told how things would happen if in case there's an emergency and how that would be handled at a home birth? Because we often,
Yeah.
when it's the topic of home birth, everybody is concerned about safety.
Right.
And for us, we know, like as birth workers, we know the entire gamut of what that looks like. Uh, but for somebody who is expecting and wants to decide, yeah, then was there a talk?
I think for me, it was important to have a plan B and C, and I talk about this even in any kind of birth. For example, you have a plan, and then you have a plan for what happens if that doesn't happen, and what happens if that doesn't happen.
Absolutely,
And I
possibilities.
think
Yeah.
that's really important, because my second birth and being a birth worker, and also because I started around that time, interestingly, doing the birthing from within approach, which talks a
Mm.
lot about um, preparing for the process, not the outcome. Of course, the desire was to stay at home and have that birth and everything plays out smoothly. But I think I was also very cognizant of the fact, and we had a lot of discussions. Okay, if there's a transfer needed, like what's the protocol? If it's the middle of the night, what happens? Because we didn't have a car where we were at, it's not the norm to have that, so that was a concern, as as compared to my previous story with the car. So it was thinking about what happens if it's the middle of the night versus, during the daytime if a transfer is required. Like, how do the ambulances work? Like, do we take a taxi? Um, can you continue with me at the hospital again, because she had a relationship with the doctor, so
Right.
she can then take on the role of a doula,
Mm-hmm.
and still be present. And what happens with my daughter? So because again,
Yes.
we didn't have a family network there. Like, where do we drop her if things
Mm-hmm.
needed to change? How do we prep her for that? So there's a lot of that, I think, that goes into the planning. And it was also very reassuring, because when we spoke about it, she said, I'm always assessing, I'm always monitoring. So if there's a situation that comes where I see that things are not progressing, I will take the call, and I will, decide to do the transfer. So, of course, I don't think you can ever plan for everything. Like, that's just
Definitely.
uh, a part of
Definitely.
that you have to kind of accept. But we felt
And
comfortable. It was a personal thing.
that's everywhere, right? We
That's everything.
cannot like predict even at the hospital, cannot predict
Absolutely.
at home.
Yeah.
Yeah.
And even in the hospital, so many times where, the doctor doesn't reach on time, or, you want an epidural but takes a while, or anything can, so you still have to always, what do I do in that moment, and how do we do it? So we felt fairly confident, I think, in her experience. And yeah, I think the benefits and the risks always when you outweigh it, right? So
Mm.
you always have to compare between what you're getting and what you're kind of not losing out on, but what you're kind of putting at a bit of a stake, or what
Back
you
burner, yeah,
correct.
the
So
back seat
it's
probably.
always making that choice, I think, with anything. So with hospitals, for example, for me, the big risk is that sort of the separation. I think that's something I'm very passionate about with mothers and babies, and what are we putting at risk when we go through that? I mean, it does look safe on the outside, but that's a huge imprint, right? And
Yeah.
so
And Namrata, that's a routine, right? In a lot
that
of
is
places
a
too.
routine, yes. And again, there's a very slow change, but again, it's not,
Mm-hmm.
I think, prioritized to the extent that it should be. With my child, for example, like, that's something that I wanted to prioritize, where there was no separation. And I wasn't very confident at the time, because of COVID and everything, that would
And then how did you go into labor? What time it was? How many weeks?
um
That's my classic question.
yeah. So, so the going into the labor was again and I love these stories. I think because they become a part of the child's sort of entrance into the world. With both of mine, I had very interesting stories. So, with him, I was given the due date of March 22nd, um, and that was my 40-week sort of mark. And March 22nd was my daughter's concert. So this was her first concert. So she plays the piano, and so it was a big deal for us, because she'd never been a part of this. And my baby's due date was the same day, and I said, no, I need to attend this concert. Like, I don't want him to come on that day. I didn't want him to come before as well, because once I had the baby, I couldn't go out and attend her concert, because it would
Yeah.
be a few days later. So I was like, no, I really want to be there. I want to watch her. And so I was discussing this with my midwife, because she had a couple of births around the same time, and quite close. She said, I'm never worried when it's close, because they never come on the day. So it's a big
Definitely.
problem if they're spread out, because then there's
Yeah.
a bigger chance of an
So
overlap.
that also takes some wisdom to understand and not worry because
Yes, for
in a
sure.
lot of cases you're
Yeah,
not
I
going
think
to
we
be
were
on the
very
day.
relaxed about the due date, but I think I was putting in a lot of effort into trying to plan that. But that's the beauty of the story, is he listened. And I think it was so wonderful, because I had this other thing personally. I said I didn't want him to come on a weekday, because my husband at that time, he had a very stressful job. Like, he was working long hours, and he'd start off early. And I knew that if I went into labor, and I had this picture in my mind where he was like on his work call, and I said, oh, I'm in labor. Of course, he would,
Ah,
tell
that's okay.
everyone off and say, okay, I'm out of service today, because I can't, because my womb.
Yeah.
So 22nd, if I remember, was a Tuesday or a Wednesday. And I said, okay, that week. So
So when you
uh,
say he listened, it's the
the
baby
baby who
listened.
listened, yes, because and the other thing was, my husband's birthday was that weekend. So he has a birthday on 26th, and that was a Saturday. Now I thought, oh my gosh, so this is a bit, wonky, because I'm wishing for him to come on the weekend. but it's my husband's birthday and I didn't want him to be born on the birthday. And as it would have it, so 26 was a Saturday, and I went into labor like Friday, like late night, like around, not labor, my water is released actually, again, very
Hmm.
similar to my first, around no bleeding or
And
anything.
not a lot, just a little bit of water
Just a
releasing.
very, yeah, just that was just very, very brief spotting. And went to the again bathroom, checked. I messaged my midwife and just said, hey, this has happened. So I think it's starting. So we'll see. And she said, kind of just like wait it out. We'll see what happens. And um I think I did go back to sleep after that because again it was quite late and the next day was my husband's birthday and we had like a little celebration at home, just like some cake and stuff, not anything really big because we knew that was again around the due date. So woke up in the morning, and we had arranged for the cake in the morning because I was kind of, as again evening time, like let's keep it open for the birth if it were to happen.
Hmm.
And I think I had very mild contractions, very similar to my first, where they came very far apart, just coming and going. And um, I have lots of pictures from that time because we had the cake delivered at that time. And I know the person who bakes it, so she's my neighbor. And I said, oh, they've started. And she said, oh, okay. So, and I think it's very strange to people to hear that again because their impression is you have a
Yeah.
contraction, why aren't you at the hospital? Why aren't you in that
Rush to the
rush
hospital.
and that scene? So it was very relaxed. I got the cake, we set up, did some basic decorations. My daughter was really excited. So we dressed up and so again, I just kept saying, yeah, he's going to be born today. I mean, what can you do? They'll share the birthday and we'll see and still quite
Yeah.
relaxed and far apart. And my daughter became my contraction timer because she loved that. Like, because we had read all these books, home birth and what she could do and
Oh,
all.
yeah, the children books
Yes,
that they
so
oh, that's so
there
lovely.
were a few. I got some from, my midwife and ordered a couple. And so we've done a lot of reading of how she could help and what her role was. And so she started mapping those out, still quite far apart. I was updating my midwife. We had a WhatsApp group because we also had a birth photographer. Um,
Mhm.
I think maybe around 8 that night, things shifted. Like she had just come, perhaps, or I said, okay, things are picking up now. They're getting a bit closer, and she said, okay, I think I should start and come over because it looks like it's time. So she obviously told the photographer, everyone, and so they
Yeah.
came
And you
around.
were sorry.
No
You were
problem.
leaking all around? Like you had
I
you
yes,
were.
I was,
And
but
this time there weren't any antibiotics, anything given to you. This was just
no, I they weren't.
yeah.
And also with this one, I tested negative for group B strep,
Yeah.
interestingly. So that was, I mean, she was very relieved about that as well, because that was one thing again out of the way that we didn't
Mm.
have to worry about.
Yeah.
So yeah, and I think they came and they started setting up the birth pool because we had that in our bedroom, and we have a lovely, I'm very grateful for that view, and that's something that actually got me through labor because we overlook a little forest reserve.
Oh,
And
I know. Is that's the same
that's the
house
one
you
I keep showing.
yeah,
Yeah, and I
yes.
just put
It's so
my birth ball
beautiful.
there and I just looked at the trees and it was so calming because it was just very, very private. There's no one there. So I could actually have the windows open because it kind of overlooks the back of our building. There's no, parking, nothing. So there was no activity. And it was the most relaxing thing to be able to see that and
To
to
be in the wild in a way.
I can't imagine, for example, if I had to look over a traffic, like a road, for example, it's
Yeah.
so stressful. Like I think I would have had my curtains shut and, do something else. But when my midwife came, I got up, to give her a hug and say hi. There was one point she had to obviously do the triage, to check the baby's heartbeat,
Mm.
check my blood pressure, all of that. I said, things are going great. I gave her an update of how things were. And I stood up and she said, have you used the toilet? And the recent times I said, no, maybe I should go. And I went to the toilet to pee. And at some time around that time, I said, you know what? Something's changed. I just know it. I don't know what it is. And she said, okay, we need to pay attention to that. That means something. And funnily enough, that was when I said, okay, I think I want to lie down now because it was so similar, the scenes to my first birth, really.
Mm.
Again, how I felt was similar, but what I did was different. And I think that
Yeah.
made such a difference to just
I
how
want you to. elaborate on that? Because during the first birth, you were
Right.
more on the bed, and this
Right.
time,
And this one as well, there was that time when I said, okay, I do want to lie down now because I don't like it. It's just an uncomfortable feeling. And I sensed that coming and I said, I want to lie down now. And she was kind of checking the heartbeat again, just to make sure things were okay. And there are photos of this. That's how I remember this. And my husband was behind me and I said, you need to massage my back because it's kind of building up in intensity. So now I knew, I was like, okay, I think it's either the end of active labor or transition. Because up until then, when nothing works and you kind of want to curl up in a ball, and I know I described that the last time as well, but it's because I was on my side and I was just very focused, and I might have entered labor line because again, that's when I did that. So it was just nice. I lay on the bed for a while, and yeah, she again she was checking me a bit, lots of scenes. I remember with the heart rate monitor, just making sure baby was okay. Husband was at the back massaging, and then I think the pool was ready by then because it does take a while to fill up. It is a
yeah,
big pool, and they were doing that, and they said, "Oh, it's ready. Do you want to get in?" And I said, "Yeah." I mean, again at that time. So I got into the pool, and I think when I did get in, I think that's really where I was in transition because I was not quite close to pushing yet, but the contraction started becoming very uncomfortable. There was a point where I was like, I don't know how to manage this anymore. Like that's what I mentioned the last time. The breathing isn't
mm,
working. Didn't want my husband massaging me anymore. It's like, what can help? And I had these little stress balls, the same idea of the cone in the hand to kind of press. So they had like these spiky things to distract, so I had asked for that, and I was laying on the side of the tub, just supporting my head, kind of in that semi forward leaning position, just wanting the water to kind of do its thing. And again, the water needed to be adjusted a bit. I was like, oh, can it be a bit warmer? Like, can it be a bit more? So we did that a little bit and then kind of finally settled. And there was a point, very, very brief. And I remember saying, this isn't working. Like, I don't know what to do next to help. And very spontaneously, and I spoke about this, last time, but using the voice, that's when something just
I was about to ask. Yeah,
I don't know whether it was a suggestion from the midwife or whether I started making the sound and she said, use that, that's what you need to be using now.
moaning or
And I'm
yeah,
moaning and I started doing that and I was like, oh, that's it. I mean, it was such a moment.
releasing the energy
It
out.
was that moment I was like, I can do this. Like, I just know I got this. I think because until then, I was like, something has to click, it's not working and I'm not coping. And I used the voice, it was really loud and it was just like, I don't care how I sound, right? And I started making that sound and I was like, I remember thinking, that's it. I got this. Like, I now know what to do. Like, I have something in my toolkit that I can use. And so I went really quiet between contractions to the extent where I was just very, very still, just kind of sitting in the water, just and when the next contraction would start, I would use that voice again, just really loud but really low, and just kind of like use it downwards. And I knew that I could do something. And I held my midwife hand and I remember saying, can you say stuff to me? Because that will help. Like, just say that I'm coping well. And I had some affirmations and stuff. So she used those. She used, yeah, you're doing that. You're almost at the end. It's done. And that helps so much again, because again, it was very reassuring, very helped me focus. I think that was a big thing that I needed. Just focus on that, getting through it. And then once it was done, it was like, and funnily enough, by this time they had spaced out. So they weren't coming back to back anymore. There was a very brief time here, even when they were back to back, which is when I was like, what do I need to do at this
Mm.
time? And I think by then maybe baby had shifted. I was in an upright position, so I was quite open, so I wasn't lying down anymore. So maybe the baby had moved a bit. So the contraction actually started getting spaced out. So I had a bit of a break again, although the contraction itself was intense. And there was a time again where I said, okay, I feel him. It was a bit different from my first one because there was a bit of a pushing stage here. He didn't come as quickly or as maybe in a good way, but so I had to do a bit of that sort of downward pushing. And I will say this, with all sort of in full transparency, despite, doing the birth work, right? It's so easy at that moment to not remember, and the importance of sort of still following the lead, because the techniques of pushing sometimes may not come to you right away. And on retrospect, I still think I should have slowed the pushing down a bit more, because I think I was like, somewhere at the back of my mind, I was like, okay, he's there, let me help, and da, da, da. And I think I could have just slowed it down a bit more for it to take a bit of its time, because he did, again, when he did come, it was in one push. He did come
Mm.
very quickly. So there wasn't any of that sort of pausing. And I teach this in classes now, that you wait and push and pause and push and pause. So you're not
Yeah.
really doing that.
Or
So
breathe down just to get over
breathe
that
down and
sensation.
kind of do that and work.
Yeah.
There was a point where I got impatient. I was like, I'm like, I need this out now. And I think if I hadn't gone there, I would have still been like, it's fine, it's taking its time. It's okay for it to take a little bit. I think maybe at the back of my mind, I was like, oh, what if he's like not moving down? And all of those worries sometimes come, and I was like, I shouldn't have probably gone there, but so yeah, he did come very quickly, and that was where that pause happened, where the midwife's like, you need to get him, and I was like, no, I need a break. Like, can you get him? And it, in that moment, it felt really long, because I remember telling, I mean, I had a bit of guilt about it. I said, oh my gosh, I didn't reach out for him right away. Like, what does that say? Like, why didn't I instinctively do it? But I rewatched the video, and it was like 1 second, and it felt like such a long pause where I was standing, not standing, so I was on my knees with my hands on the side of the tub, kind of like sort of out of the water. So it was a
Okay,
interesting
so
position.
it was a cat and cow position on in the pool.
It was
Simple.
not cat. No, it was not
No,
also.
it wasn't.
I was sort of
Yeah.
leaning over the side. I had my hands on the side of the tub, I think, because I was trying to. So it was actually like a kneeling position, kind of
Okay.
stretched out,
Got
because
it.
I was also working with the push, and he kind of came out really quickly into the water, and she kind of scooped him up, and I had to obviously turn around and get my leg over the cord to sit to receive him.
And there was a cord around the neck, was it?
No, there wasn't a cord. I
There
had to step
wasn't.
over the cord, because I was sort of,
Okay.
he had, in a way, he had actually come from behind. Like, she had
Yeah.
received
Yeah.
behind me, so I had to
Yeah.
over and reach out to him. And
That's also a thing we can like speak about, that babies come from behind when it's
yes,
the
from behind,
yeah.
and you kind of reach out. And again, you're very mobile, because at that time, once he was out, it was a huge sense of relief, I think, this time. Not relief in the sense of, oh, it's done, but oh, he's here, like I get to meet him. And so the connection was, I think, a bit more uh, different, in the sense, because I was already a mother. I feel like that door had opened. Like with my first, because I had so many layers that I had to kind of, I think, open up before I reached to that place. I think with him, I already knew how it would feel to have a baby and sort of have that. And with this one, he cried, and I don't know why he did. So I was like, why is it because I didn't take him right away? And I had all these thoughts, but he had
Mm.
this very brief moment where he was crying, and I remember my husband saying, he said, I was really worried. I don't know why that was. And I took him, and I said, oh, soothing him, and he got really calm. It was very, very nice, because it was very instantaneous, like for me, very instinctive to just say that and take him onto my chest and do that. So yeah, we did that, and then spent a few minutes there, and my daughter got to touch him, and she was there at the birth, by the way. She was present. Um,
All along.
all along. There was a moment, because, and a side note, he was born at 1:20, so he waited for the
Yeah.
age to change.
Wow.
So it was already late for my daughter, and I think she had started getting a bit cranky, like low on patience. My husband was trying, so they had a bit of a disagreement, and so she was sulking in her room, actually. And there was a point where I was in transition. I told my husband through that, I said, "You need to get her here, because he's gonna come, and I want her to be here, when he's born." And he looked at me like, really, this is what you're worrying about now? And he told me that. Like, that's when I realized, like, oh my gosh, that's how connected you are to her, that in the middle of that stage of labor, because I was watching you and I saw how intense it was, you still said, go bring her. And so she did come, and so she was there. So I think it was maybe about 20 minutes later, I think.
Yeah,
On,
yeah, yeah, I get it.
watched him being born, and she said, "Oh, that's the most magical thing I've seen." Like, to be.
Yeah, I
And
say.
she touched his head and his hand, and very like carefully. And so we got out of the tub, then went to the bed. Kind of wait for the placenta to be born, and holding him. He also didn't latch right away, so we spent a lot of time just kind of rubbing him, kissing his hair, just being very like, wiping him.
Hmm.
And that's it. We waited, and the placenta came.
After
But
you had the baby on you, so that's
I
also
did. I had the
like.
baby on me throughout. Like there was absolutely no. And my daughter was lying next to me, and she was just like rubbing his back, and husband was actually busy because there was a lot of things that needed to be brought and taken off, like extra towels, all of those things. And yeah, I just lay on the bed, just waited for the placenta. This time I did see it. I spent a lot of time like looking at it because again,
Uh,
something
did you not see it last time?
I didn't see it. No, it didn't occur to me.
Ah,
I didn't know that like that's how
yeah, yeah,
naive I was. I didn't
hospitals.
know there was that happens, and so I didn't even. I mean, it wasn't even in my conscious memory to
Right,
ask to look at it. So this time I was
right.
very particular that I saw it. So we did a few prints of the placenta to save, and my midwife always said, "Oh, I look at the placenta to see how the mother's been eating because I can tell the quality of that." And so I was like, "How does it?"
Okay.
She said, "No, it looks fine." It was great. It
Mm,
all came out in one go, and so in that sense, it was a bit of a lotus birth. So we didn't cut the cord yet. So there was a moment where the baby and the placenta was still attached, but I wasn't planning to do the full-on lotus birth thing.
yeah,
Placenta
yeah.
is on. So
That is, Namrita, please explain what lotus birth is
right,
to anyone.
I will be careful to not misspeak because I'm not super, familiar with that. But I know it's a practice where you keep the placenta and the baby attached until
Yes.
the cord falls off naturally. So
Yeah,
again,
that's what it is. Yeah.
and
So it can take a week or 10
right,
days.
right, because the cord
Just,
dries up and then
yeah,
eventually as it has
yeah,
to
yeah.
fall off. So
We
you're not
preserve, yeah, we
right.
preserve the placenta all along. So, yeah, the
And in that
baby is
time, the
attached.
placenta starts to dry up as well because it's
Yeah,
again an organ.
yeah.
So we didn't do it to the full extent. We did cut the cord, I think maybe within an hour or something. I don't remember.
Mm. Mm.
Be with the baby and bond with him. And eventually, after the latch, etc., then the midwife kind of took him, weighed him. She has this very old school weighings,
Yeah.
which I love.
That one, the one that
The
looks
one
like a
that
swing.
yeah, like
Yeah, yeah, they're
that.
beautiful.
We have pictures of that, so that was lovely. And
Wow.
very gentle, again, just measuring him, his height and weight and all of that. Uh,
And was there a difference between the ultrasounds the two times around, with the midwife and the?
the midwife does more the Doppler and the belly mapping with her hands,
Yeah,
so there wasn't an ultrasound with her. The ultrasound,
throughout,
yeah, throughout.
throughout the.
There was
That's
more
incredible,
tracking the baby's
incredible.
heartbeat, and she used her hands because she was again doing it consistently, so she knew how you
Yeah,
know
the fundal height. Yeah, there are a lot
right.
of
And there
parameters
was
that
a
you
bit
can
of
check with.
concern, for example, at some points because he wasn't positioning himself like really, because he kept moving a lot and his head wasn't exactly where it needed to be. So there was a bit of like, yeah, she's like, yeah, I can't feel his head right where it needed to be. He's a bit off, but eventually, he settled into
Yeah,
enough to, be
yeah.
able to
They just
exit.
do it.
Right. So yeah, and then that was it. I think that this time it was 3, 4. I think there was that sort of tiredness setting in, and people had started getting
Hmm.
tired. And so we wrapped. I think that was it. So they cleaned up. They did a beautiful job. Like you wouldn't think there was a bird there. Like the way that the tub is not a joke, and you want to clean it up because there's so much of, the tissue and stuff that's released. The water itself has to be changed and has to be dumped out because it's a big tub and deflated and all of that. And I might have gotten a bite to eat. I don't remember now. My daughter fell asleep actually right after that. She was falling us down. Like you should get some sleep. So we found a spot for the baby in a little crib that we had and next to me, and we all got some rest. And I think maybe woke up around 6, 7, 8, something around that time. I don't remember now. Fed the baby and updated the midwife. She's like, I'll sleep for a little bit and come see you around 12 again. So
Hmm.
she came in actually that afternoon to check. So again, the postpartum is another part where the midwifery care is very different. Uh,
Yes.
right, so she came many times in those early days to just check on baby, check on me, make sure things were okay. I did have a bit of a tear. We made the decision to actually let it heal back on its own without
No
stitches. That
stitching.
was,
Yeah.
yeah, so that was,
That's a good thing.
there was a bit of history to that. So we were just like, okay, let's see if it works that way and if it's healing. So I had to obviously be a lot on trying to make sure that it was clean and that I wasn't stretching my legs out and stuff. So there was a bit of that. In fact, that I feel out of the whole thing was the part that needed, my attention, sort of
Yeah.
slowing down because everything else was very smooth. So,
Mm.
um, but
Did you have a tear the first time around?
I did have a tear the first time around as well.
And it
I
was
also
stitched?
yes, it was stitched, and I think there was something about the stitching as well because it felt much tighter than what my normal body was, which was also another reason why the second time we said maybe if it heals naturally, it goes back to how it would normally be. Otherwise,
Yeah.
there was
There's this fibrous tissue that develops with stitching. That's the reason with stitching it takes time to heal. There's more time
right.
that needs for healing than a natural tear or a
That,
bruise. It just
yeah,
heals better off
yeah. So
statistically. Yeah.
right. So we did have a lot of back and forth about should we go in because she said if you have to go in for stitching, this is something that I cannot do because it was. And she said, no, I've seen this happen. Like amazing how the vagina heals itself and kind of fuses back, and that's exactly what happened, right? I
Mm.
mean, it does obviously. It's not as instant gratification as a stitch because it takes a while.
Mm.
You have to do that, but indeed it happened, and I think it definitely is different from the first time round because like I said, I think it was a bit too tight. So you can know, I think, your own body, and I did
Mm.
realize I was at that time I thought maybe this is just how it had to be done because there was a tear. I'm trying to think of the technical word for that. What's called a transverse septum in the hymen. So I had a surgical procedure like way back to actually open that inside. So
Okay.
we've actually wondered since then if that scar tissue actually makes it easier, perhaps for me, specifically to tear because otherwise with both my pushing stages, they weren't as
Yeah, you didn't even push the first time around. So I've
reason why that skin was so perhaps fragile as compared
grown to.
yeah
Yeah.
onto that. So we were, and which was actually my only fear with the second one as well. I said what if like because I already have something that's stitched up, like what if, and anyway it was maybe in a way
And
yeah.
how did it look like both the time around with you having to deal with a stitch or
Mhm.
a natural healing? How did it feel for you?
I think with the first one I was just really naive. So I don't think I was so caught up in the baby, right? I was just the second time round because I think we were allowing it to heal naturally. I had to be more careful, and I was at home. I was also, you know, had more responsibilities. I think so. I had to. I think things that I did that helped. I think this is for actually all care protocol is keeping legs together. So I wasn't, allowing the tissues to sort of have that chance to
Mm.
fuse back, and lots of sitz baths with Epsom salt, keeping the area clean. So making sure that like washing it frequently because again you pee and poop and there's lots of
Yeah.
chances of infection, so you're just trying to keep it as clean as possible so there's no chance of infection. So I think it maybe have taken a few weeks, but it for my situation it was, I think, the best decision because I wasn't too keen on stepping out. I didn't want to go out those COVID that had to take the baby, and I feel like that was more putting him at risk because everything was just so in that situation I think it just worked in the best way.
And it works. So it works.
Yes. Yeah, it does. It actually heals back without.
Needing
Of course,
stitches.
it takes time, and you have to do other things, and um, people sometimes just want to be done with it and move on. So,
Right. And I have heard, and that's also one of the things that comes off is sometimes when episiotomy is done, especially
Mhm.
routine that's like here in India, which is not required, So you being cut when there's a little bruise or a tear, that's not required. So
Right.
with that, especially the artificial cut that's given and then the stitching, it makes that area really, really tighter, like you said. And a lot of the times it keeps paining, even if you've given birth like 8, 10 years.
Absolutely, even if you're given birth and even when you have sex, like all of that, like no one talks about it, right? And there's so much shame around it. Like, who do you can't go tell your OB-GYN, oh, it hurts, because they'll be like,
Yeah,
is there, I think there's so much embarrassment around talking about, sex postpartum, but there's so much that happens, and absolutely that's because the body has changed its size and
right.
again, not without risks, right? We tend to overplay the benefits a lot of procedures.
Definitely. Yeah.
Definitely another side that needs to be addressed.
Yeah, yeah, yes. And the last one that I've written, two things that I want to talk about. One is like I said that your work with informed, trauma care, that working on fears and everything. And how long did the baby take to latch the second time around? So you said it took a little
Oh,
while. So yeah,
I think a little while, as in probably my mind was, yeah, I think it was in the first 1 hour as well. In
1 hour.
fact,
Yeah, okay.
really easy. Yeah, I
Yes,
think
they'd go
in my
through
mind,
those
it was fine. Yeah,
eight,
it
yeah,
was
eight
because a
stages.
lot.
Yeah.
For a while, yes, for a while he was kind of laying on my chest, and we weren't in a rush again because I think this time around I wasn't. I knew it would happen, and I was like, I need to prove this to myself that he can breastfeed because I was like, yeah, he'll get to it. So I was much more
Yeah.
relaxed. We were talking, taking photos, and yeah, at some point I offered the breast, and he just kind of took it on and
Okay.
fed a little bit, and I was like, okay, so his latch is fine because I know sometimes babies have physical
Mm.
issues with latching, very rarely, but it happens. So for me, that was ruled out because he could do it. And what's the other
The
thing?
other was your work with trauma informed care.
Right. Yes, so in my own journey as a birth worker, I think there's been a lot of evolution. I started off, like I said, with hypnobirthing. I trained with Lamaze, and then I eventually found my way to birthing from within by
Mm.
starting with Pam England. And just personally for me, it just feels very aligned because I have moved away from, I think, this notion of this one best way to birth and one kind of birth experience because I think there's so many aspects that go into birth that can't be defined by the outcome is like a little checkbox of vaginal cesarean, good, bad,
Mm.
um,
Definitely.
right,
Yeah.
wrong kind of thing. And I think again we hear so many women who have had those textbook births who aren't happy with it, and people who've gone through what would be considered traumatic but actually feel like that's they've done very well. And so um, everything that I have learned, the journey that I have been on as a birth worker, I think at this point it just feels like I've reached home. Like this is my home with like birthing from within. Because while they do talk about all the prep work you're doing and all of that, there's a lot of emphasis on how can I still be compassionate with myself despite anything I may or may not have done in the birth. I think for a long time with my first birth, as if I describe it, it's actually a pretty perfect textbook birth. Like I
Mm.
did everything I wanted to do, and yet I came after that saying, "Oh, look at me! Like I was on the bed, I was." I screamed when he was born because it was so sudden, and I think what I lacked was just recognizing what an amazing job I did do, like all the things I had done.
Definitely. Yeah.
Granted, they
The
weren't
first
planned.
time around. Yeah, yeah. Such an amazing job without
And
help.
exactly. And yeah, I could have celebrated all of that. And yet I said, oh, see, I screamed. And I think as I started doing the birth, I said, how can I take women away from that mindset of I need to do this. And if I don't do it, that means I haven't done
Yeah.
anything. Because people would come back and say, oh, I didn't have the
Mm.
hypnobirth because I asked for an epidural. I said, but and that's exactly what crossed my mind. I said, but think of all the amazing things you've done until then. You've advocated for yourself. You had a birth plan. And they wouldn't see that because they would get fixated on that one forbidden thing, right? They said, I didn't want
Right.
an epidural. I got one. Does that mean I failed? And I think for me, that's been my learning from the current training I'm in is like, how do we take away from getting fixated to having that space to say that's the plan A, B, C that I spoke about. And I think a lot of my own second birth, like learning came from that.
Definitely. And birth kind of takes all of who we are and it
Yeah,
just opens the chapters that we never did,
absolutely.
even with parenting and postpartum. So it's such a I often see myself in the last 4 years with having my daughter, what I've done that I would have
Yeah,
never done, leaving a job, getting into birth work,
yeah,
trying
yeah.
to do things that I never thought, and then
Mm,
going over, that those phases of improvement, when you're working as a freelancer. So definitely that birth
yeah.
changes you in so many
And
ways.
the narrative is so important because you could have gone through the same changes and said, "Look at me, like I have no choice. I had to leave my job. I had to quit." Versus, "Look at me. This has opened so many opportunities that I wouldn't have had if I hadn't gone through that experience." And so the story we tell around that is really important. And I think it's the same with birth, right? You have a hard labor and you say, "Oh my gosh, look at how much I suffered," versus, look at all the things I did right to get through that. And I think that's the prep work that is needed.
Yeah, so that's the hero's journey that you often speak about.
Absolutely. Yes, yes, yes. I'm so glad you brought. Yeah, that's the hero's journey because the hero goes into that preparing, but not, you can't plan for every situation.
Yeah. Thank you so much, Namrita. This was a wonderful conversation and really layered, and we could really open up those little boxes, those little things that really matter that can help women understand how this happens and maybe brace themselves and also ask those questions that they need to write down what they're scared of and then work with someone who help them navigate. Of course nobody
Right,
can navigate for you, you'll have to do the work, but also
right,
a hand, when you're held throughout it,
right.
it means so much. You
Yeah,
can just do it, you
absolutely.
know how to do it.
Oh, thank you. It's a pleasure. And as always, you're such a wonderful, I think you have a gift for this because you know how to open up those boxes, as you said, right? That's really important. So thank you. It's an absolute pleasure. And thank you for having me and
Yeah.
for listening to my story.
Birth stories continue in the upcoming episodes. Make sure you follow the podcast to be notified of the new stories. There is a field beyond fear where the body is empowered to take on labor and birth. To land there, it is crucial to take birth education. To enroll into our unique labor and birth preparation course, reach out to us at www.birthagni.com or scroll through all available prenatal and postnatal preparation classes. Thank you for listening, all in the spirit of birth, womanhood, and freedom. Remember, you got the power. This podcast is about physiological birth and does not offer or claim to provide medical knowledge or diagnosis.